going to see the contraindications for the thrombolysis. So mainly it would be the things that can make the patient to bleed, that are prone to bleeding, or that increases the damage with bleeding. So the mnemonics would be sample, stage. So the S could be a previous stroke or head trauma in the first 3 months. A, anticoagulation if the INR is less than 1.7, or if we have the PTT prolonged. Then M is a myocardial infarction within 6 weeks, or a CPR within 6 weeks, or a aortic dissection. Then the P is for platelets, so platelets less than 100,000 per cubic millimeter. L for L for low platelets, that is this, and the P is for platelets or for prior surgery within could be prior surgery or could be prior head hemorrhage. In this case, we could say head hemorrhage within or prior hemorrhage of the head. Then low platelets, E, it is elevated systolic blood pressure greater than 185, or elevated PTT, PT, etc. S would be a surgery, major surgery within 14 weeks. The T is a transient ischemic attack. A does not count. G, gastrointestinal or gastrourinary surgeries or traumas, mainly surgeries, gastrointestinal hemorrhage. E of, again, elevated, in this case we're talking about a elevated glucose more than 400, or a low glucose below 50 milligrams per deciliter. And lastly, the S of seizures. So we have a stroke or head trauma within 3 months of now the onset of the symptoms. The anticoagulation, a INR less than 1.7, or a prolonged PTT. Prior myocardial infarction within 6 weeks, or a CPR or aortic dissection. Then a prior intracranial hemorrhage or head hemorrhage. A low platelets less than 100,000 per cubic millimeter. Elevated blood pressure above 185 of systolic blood pressure. The prior surgery, major surgery within 14 days or 2 weeks. I don't know what did I say. Oh, sorry, 14 days or 2 weeks. The transient ischemic attack, or the gastrointestinal hemorrhage, elevated or abnormally low glucose levels, or seizure at the time of presentation. If we can correct the abnormalities on the lab or on the measurement that we have, for example, we can correct the pressure, or we can correct the anticoagulation or the glucose levels. If we can correct them on time, then we can consider again the thrombolytic.